started, given that we're just going to go through an introduction, people will trickle in as we go. So good evening, everyone, and welcome to our session on AI confidentiality and privacy as part of our emerging business trends in primary care. My name's Natalie from Northwestern Melbourne PHN. I'll be your facilitator this evening. So I would just like to start by acknowledging the traditional owners on the lands on which our work takes place. So at Northwestern Melbourne PHN, our work covers the lands of the Wurundjeri Woiwurrung, the Boonwurrung and the Wathaurong people of the Kulin Nations. I would like to pay my respects to their elders past, present and emerging, and as well as extend a special welcome to any Aboriginal and Torres Strait Islanders present this evening. Okay, so we'll start with just a little bit of housekeeping. So we have popped everyone on mute. Obviously, unlike me, apologies for those that got my Mad Max comments about the United States earlier when they first logged on. The session is being recorded. So after the session, when you get your email, you will receive a copy of the recording and a copy of the slides as well. So don't panic too much about taking notes. Really just we want you to follow along, get a good understanding and have the opportunity to ask questions, and you'll get all the written materials and resources in the next couple of days. On the bottom of your screen, you should have a link to a Q&A box. So if you do have questions that you would like, just pop them in the Q&A. Well, we will take some pause moments throughout the presentation and pose questions to our excellent presenter. So use that one. All right. In terms of the Zoom webinar, so in order to allocate your CPD points and send out your certificates, if you could just make sure that your participant name matches your Zoom name. If it has something other than your name, so, you know, Natalie's iPhone or Samsung Galaxy, whatever, you can just send a chat message in the chat box to the education profile and we can pop that down. Wonderful. So let me do the introduction. We are so lucky this evening to have Miroslav with us, who's the Managing Director of Digital Medical Systems, which has been providing IT support and services for pretty much as long as I've been alive, Miroslav. Not gonna,
oh, wow, that makes me very old.
Never. So he's done a lot of work previously with other PHNs as well as ourselves, along with the RACGP, the Association of Practice Managers, doing education and security, IT and cybersecurity education, both through webinars like this and also by written articles, which has been wonderful. He's completed a Master of Cybersecurity last year and also has a graduate certificate in cybersecurity and is a cybersecurity practitioner. So welcome, Miroslav. We're very excited to have you here this evening.
Well, thank you very much, Natalie, and good evening to everybody. I can't see you all in this fantastic technology called Zoom webinars, but thank you very much. AI is a very big topic of conversation these days. It's becoming part of everything that we do. There are a lot of people who, like myself, when it first burst onto the scene, even though it's been around for a very long time, but it's only just now become usable in the last 2 years. Well, what is it? How can I use it? Is it safe? And especially, is it safe to use in my healthcare clinic? Whether you're a clinician or a practice manager or a practice nurse or an admin person, what is it? And we want to see what it can do for us. But before we see what we can do for us, what we want to do is we want to know that it's safe. So generative AI, which is what I'll be talking about, is a particular kind of AI. And what I want to do is I want to highlight what it is. So there'll be two parts to this presentation. Really an introduction to generative AI. You can see the headings there. We'll look at some case studies in healthcare, including here in Victoria. And we'll also look at privacy and cybersecurity obligations in healthcare. And the risks of using Gen AI. There's the reward of productivity and of automation, but there are also risks which we have to be aware of. And there are guidelines that the Australian government and other agencies have issued, including the RACGP, the AMA, the ADHA, and other agencies have issued guidelines. And then part two, what I'm going to do is I'm going to introduce you to Microsoft Copilot for admin users. I'm not going to demonstrate AI scribes, which I know a lot of doctors are using, including a lot of my clients are using AI scribes, because they're pretty simple. Not only, and it would be a bit boring to actually demonstrate those. They basically record the presentation and then give you a summary or a transcription of the interaction that you may have with your patient. So I'm going to look at the copilots for admin, and then there'll be opportunities that Natalie will manage for us for Q&A. So please, if you have any questions, put those in your Q&A box or chat box. And also, I'm happy to stay back a bit later if someone wants to ask some questions, and if 8 o'clock our scheduled finish is not a big deal for you, I'm happy to stay back. So with that, let's go. Now, I have a lot of slides, a lot of content. Don't be overwhelmed by it, because you'll have the recording and you will also have the slides themselves to refer back to it. But there's a lot to set up the context of generative AI in healthcare. Okay, so Alvin Toffler, who is the author of Future Shock, wrote this very, very interesting comment. And he says that the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. And from all of my long years of working with the medical profession in primary healthcare, I know that doctors and nurses and practice staff are continually learning, unlearning, and relearning. And that is absolutely true when it comes to technology. And I've certainly seen the use of technology from the mid-90s when the practice incentives program first came on board for computerizing and getting rid of all those click-clack Medicare voucher machines and all of that kind of thing, to where we are today in 2025. It has been just amazing when I look back on it. The American Medical Association defines generative AI as a type of artificial intelligence, AI, that can recognize, summarize, translate, predict, and generate text and other content based on knowledge gained from large data sets. Now, the important thing here to note is that it can predict and generate text and other content. Please keep that in mind. The Australian government last year issued a national framework for the assurance of artificial intelligence in government, and that framework defines AI or Gen AI as a machine-based system that, for explicit or implicit objectives, infers from the input it receives how to generate output such as predictions, content, recommendations, or decisions that can influence physical or virtual environments. That is very important to understand, which will become more obvious. APRA defines AI as computer systems able to perform tasks that normally require human intelligence, such as visual perception, speech recognition, decision-making, and translation between languages. And whenever we talk about AI, whenever we talk about IT and my end of technology, we always go back to Mr. Bill Gates, very famous, of course, one of the two founders of Microsoft. He says in his blog that the development of AI is as fundamental as the creation of the microprocessor, the PC, the internet, and the mobile phone, and that it will change the way we work, learn, travel, get healthcare, and communicate with each other. Now, have a look at this. Businesses will distinguish themselves by how well they use it. And of course, healthcare being a very conservative, of necessity, by being a very conservative profession, it's already having a pretty big take up of AI. Bill Gates goes on further saying that in the very near future, we're going to have a personal assistant powered by AI that's beyond even what we see today, and that we're going to have what they call agents or agentic AI, which is the next thing that I'm getting in all of the reading and all of the information that I'm looking at. So it's going to be the biggest revolution since we went from typing commands onto a text screen, which I remember, and when I was at uni, that's what we had, to tapping on icons. And how could we imagine going back to the old days? Professor Ian Opperman, who's the New South Wales government's chief data scientist, tells us that AI is likely to have just as profound an impact as electricity. As AI becomes embedded in devices, tools, and systems, it becomes invisible to us. Just imagine that for a second. Electricity, what it would be for our ancestors that didn't have electricity, to what it is for us whenever we have a power outage here in Melbourne or anywhere else, whenever we have those wild storms or anything else where we get an outage, or when clinics run out of power, or power fails at a clinic, everything stops. It's a disaster. Dr. Opperman also warns us that just as electricity is very valuable and useful, it's also dangerous. Don't put a fork in the toaster or the socket. Understanding data-driven tools is critical. A chatbot or an AI software program is not a web page. It's not like going to Google or Bing search and doing a search on those programs. Dr. Opperman says, for any decision which matters, there must always be an empowered, capable, and responsible human in the loop, ultimately making that decision. And this is nowhere more important than in the practice of medicine itself. As everyone on this webinar will understand, we must always make sure that patient safety and privacy and security is paramount. McKinsey and Company, late 23, issued a report, and they say that AI represents a meaningful new tool that can help unlock a piece of the unrealized 1 trillion of improvement potential present in the healthcare industry, automating tedious and error-prone operational work, bringing years of clinical data to a clinician's fingertips in seconds, and by modernizing the healthcare system infrastructure. And of course, one of the things that we have to make sure is that we don't break the existing healthcare system. We enhance it, we help it, we make it more efficient, more effective, but not create new problems, because there are enough issues in our healthcare system, because all the practitioners and the clinicians and the practice managers that I know are absolutely overwhelmed by the amount of work and by the amount of information that they have to deal with. So we want to improve that we don't want to put a spanner in the works. All right, let's have a look at some concepts on AI. So generative AI, which is the AI that we're talking about, uh, is actually a collection of components. Machine learning, large language models, or LLMs, you would have seen that in lots of different media. Human language AI, very important, and deep learning, all of which are powered by neural networks. And according to Gartner, which is a think tank specializing in technology, they say that we're still at the very top of what they call the hype cycle. So you can see in the slide there with the red circle, that's where we're at. And then of course there'll be a decrease as the uptake and the interest. It just becomes okay. It just becomes part of people's lives, and there won't be so much hype about it. We'll just get on and use it and learn how to use it, what it does, what it doesn't do. Now, all of this started just a bit over 2 years ago, back in November 2022, with the release of ChatGPT 3.5 by an organization called OpenAI. And this was a natural language processing system using deep learning, and it was a pre-trained transformer system that was trained on huge amounts of data. And then, of course, since then, we've had thousands, literally thousands of AI chatbots and software and tools and all sorts of things, many of which many clinicians have been exposed to, for example, with the transcription or AI scribes. And just by way of interest, when ChatGPT 3.5 was released, in 5 days it surpassed 1 million users, and at that time it was the fastest uptake of any software or any technology before that. So that's just an interesting stat. Everyone said, I'll have a go at that. That looks interesting. What can it do? We can do recipes. One of my engineers used it to use ChatGPT very early on to organize a itinerary when he and his wife went to Vietnam. And everything. And when he came back, when Callum came back, I asked him, how did it go with the ChatGPT itinerary? He said it was fantastic. Everything just went, all the hotels, all the transport that they organized throughout Vietnam went well. Now, the GPT in ChatGPT stands for Generative Pre-trained Transformer. This is important. It generates text or other forms of output, and it generates human-like responses. So it's new information that it's generating. It has been pre-trained. It has been pre-trained on huge amounts of data. And this training process helps the model to learn patterns, grammar, and context from the text it is exposed to. Not only that, whenever we put in a prompt into ChatGPT or any of these Gen AI tools, it learns from our prompts as well, so that the training, we contribute to its training by the information that we put into it, we ask it, we upload it. And it's a transformer. It is a type of neural network that is actually based on probabilistic algorithms, and that it works on relationships and dependencies between the words or anything actually that the thing is given to work on. It could be the pixels in an image. It could be numbers if it's a number task that it's given. But in ChatGPT's case, it's a text-based transformer primarily. Now, I thought it's useful to understand what's inside this black box. What's under the bonnet of this car? What works? How does it work? Just to give us that little bit of understanding, because unless you're a mathematician or a programmer, a lot of these things are a bit obscure and even a bit arcane. But basically, it's based on simple equations and lots of them. There is a input layer. There are inside the hidden layers, there are nodes. So think of the nodes that we have in the human brain or in a mammalian brain, where we have neurons and we have synapses and we have various pathways. It's what they've tried to do is they've tried to replicate a little bit about how the human brain processes information and works. And then there's an output layer. And what you can, of course, do is you can multiply this to the nth degree. And this is where the models get exceedingly complex with lots of inputs. But basically what happens is that these nodes, these inputs here there is a weighting put on, there is a bias, and then there is a calculation. And so each of these, there is an input, there is a weight put on that input between 0 and 1, and then there is a bias attached to that. And it comes out with the output. And of course, given modern technology, the huge processing power that these models have somewhere in the cloud in huge data centers, this all happens in amazing short amounts of time. And here we go for the mathematically minded. Here's another equation which describes how this goes through each iteration that it goes through. What's a large language model? Well, a large language model is huge amounts of data, billions of parameters. And what it does is it computes a result rather than looking up a fact like Google does, Google search engine. It's non-deterministic, which means for the mathematicians is that we can set the algorithm going, but we cannot control what comes out at the other end, which is really interesting. Hence the training, retraining, constant training. The input uses natural language, so you don't have to be a computer programmer to interact with it, and it understands pretty much all spoken languages, including the really difficult ones. So if the language has been digitized, and if the information pertaining to that language or information recorded in that language, it learns it quicker than any human can, and it's just incredible. It's based on, as in previous slide, on layers of these nodes. Each node has a weight, there's a bias parameter, and the number of parameters indicate the size and the complexity of the model. And the more parameters, it can learn more complex patterns quicker. And just to give you an understanding of the LLM or large language model types, have a look at this. And these are just some of the different large language models: BERT, T5, XLNet, Electra, Llama by Meta, and then we have the GPT series now from OpenAI. GPT-1 had 117 million parameters. The next version had 1.5 billion parameters. GPT-3, 175 billion parameters, and GPT-4, which is the current version, has 176 trillion parameters. It's an exponential increase in the number of parameters. So it is just astonishing. And the time it took to get from GPT 3.5 to 4 was, in fact, they were already working on it before by the time they released 3.5, but it was just an amazing growth and development. Now, how do we interact with a chat GPT or a Microsoft Copilot or any of these generative AI chatbots or tools? Well, we use what's called prompts. And in fact, there's a new job description in technology called a prompt engineer. I kid you not. So there are people who, that's their title, that's their description. And I'm told in the US that they are paid hundreds of thousands of dollars because a very clever prompt engineer can extract better quality output from this non-deterministic AI tool than someone who isn't as good a prompt engineer, and they are given huge salaries. So, for example, you could ask, what is Microsoft 365? Tell me in one short sentence. And there's the response. It's a collection of powerful tools to help you work, connect, and create. Here's another one. Now, you have to try to be as efficient as possible, and you have to, as succinctly as possible, tell it what you want. Think of a chatbot as an eager teenager who comes for a work experience to your clinic. You have to explain to that teenager what you want it to do in very clearly, so that they don't, and I know many clinics, they might have a teenager come in or a uni student to scan letters or whatever, and to do that job that no one else wants. You have to give them very clear guidelines. So if you say, please give me the history of humans, it's going to take a long time, because it's going to go and say, okay, I'm going to give you the complete history of humans. But a better prompt is, please give me the history of humans in 3 sentences. And that way we can cut down both the amount of time, computing time, and what we actually want out of it. So prompt engineering is a critical skill, and a good prompt produces a better output than a bad or a unclear prompt. So we have to be specific. There's some structure to it. We have to give it an example. Tell the AI what you want it to do. Give it the context. For example, and I'll show that. I want to write an article for a professional medical audience, or a professional journal to a medical audience in Australia. Give it the context so that it knows what you are wanting. Give it some roles. So, for example, you might say, you are the practice manager, and I want you to write a job description for a position that we have at our front desk or in our admin team. And this is really bizarre. Be nice to it. Be polite. Give it encouragement. Say thank you. You get better results. I mean, what? It's just software. I mean, seriously? Yes, you get better results. I have an example where I know one of the senior Microsoft vice presidents for Asia Pacific, a lecturer at La Trobe Uni called Abbas Kudrati, and he told me that if you offer to pay it, it will give you a better result, even though there is no mechanism for me to pay it. I can't say I'll give you $500 if you do this for me, because there's no way I can give it $500, but it gives you a better result. It's trying to be as human as possible. Okay, let's have a look at some case studies.
Just as we're at the halfway time mark, I'll just quickly, if anyone has any questions that they wanted to jump in and pop into the Q&A box, if you've got anything, please do throw it in. There's nothing there at the moment, but we will take time. So don't hold back. If you've got things you want to ask, please pop it in. But otherwise, we'll keep going, Miroslav.
Yeah, thank you. And if you have any questions about the technical side, I'm happy to try to answer those. But I thought that the previous section was important to provide the context as to what we're talking about. Okay, so what can it do for a clinician? Here's a real-world case study. A major hospital in Taiwan has deployed, as it turns out, Microsoft AI Copilots. That's why Microsoft is highlighting it. Because their doctors are overworked, their nurses are overworked, their pharmacists are overworked. They don't have enough medical professionals in Taiwan. We could just replace that with Australia, and we would all agree. So, for example, in the pharmacy, in the hospital pharmacy, they have created using Microsoft's Copilot in Microsoft's Azure OpenAI service. They've actually created a pharmacy Copilot, and the Copilot obviously has been designed to understand all of the pharmacy workflows and all the data, medication lists, records from the hospital, allergy lab tests, everything, right? So it has access to all of that information that it was trained on. And what that means in real terms is that one pharmacist can now see 30 patients a day, double the previous 15 patients a day. So that means they can spend more time for patients with complex needs, or talk to the prescribing doctor, and that's what it's all about. That's what we want. We want an assistant that can help us. And the whole point of what this particular hospital in Tainan is doing is that it's aiming to cut down the paperwork, the absolute burden of paperwork and dotting the I's and reporting and all of the things that you people in healthcare are struggling with. And it can do all of this much, much quicker than a human can. For example, there are many doctors, and I'd be interested, Natalie, to if you did a straw poll, how many clinicians within the PHN catchment area are using AI scribes, for example, transcription? That would be an interesting question from me to everybody out there. So now this is really interesting because AI scribes, and there's lots of them. Now here's something that just came out yesterday. Ramsay Health has created their own AI-powered clinical documentation tool that they're rolling out through, first of all, in some initial hospitals, and then they're going to roll it out throughout their network of hospitals over the next few months. But there may very well be people taking part of this that are using any of these products: Heidi, Liebird Health, iScribe, MA Medical AI Scribe, Avant have a new product called VoiceBox Intelligent Transcription. And apologies there are others, but I just, as far as I know, there are over a dozen that have been developed here in Australia for the Australian healthcare context, which is fantastic to see that Australian doctors, often it's doctors who are interested in technology, are designing this or telling programmers what they want. So I'd be interested to know how many people are using these transcription tools. And Many of my clinical clients are using transcription tools in there. Pulse IT magazine, they just recently, back in January, they reported on AI being used in diagnostics for lung diseases. For researchers from Charles Darwin University, United International, Australian Catholic University. And here's the interesting thing: identifying patterns with different lung diseases, classifying ultrasounds into diagnostic categories such as normal, pneumonia, COVID-19, and other lung diseases, an accuracy of 96.57%, as verified by very experienced medical professionals. Here's another one: wound care being used by boosted by artificial intelligence product from from Amplar Home Health, and that's complicated. And what it does is it analyzes the photos and videos of a wound with computer vision technology, then calculates the surface area and volume in millimeters. And of course, it would have color. It would have the ability to discriminate between the various colors on a wound, and then analyze the colors in that wound, etc. And this is very important for many people, especially I was involved many years ago in a wound care that didn't use wound care product that didn't use AI, but there are many people with diabetes, for example, that have, if they get wounds on their feet that are not treated, they can get into trouble with their feet, including amputations, etc. Now, here's something that's really interesting from just a week ago. AI chatbots outperform doctors in diagnosing patients, this study finds. This is from the US, from the Beth Israel Deaconess Medical Center, and they were using it to evaluate whether chatbots or physicians can diagnose patients more accurately and quickly. So, wow, I don't know where this is going to end. Maybe, as Bill Gates says, we're going to have agents that can help us in our work. Now, here's a case study. Now, Bendigo Primary Care Centre, my company provides IT support for them and have done since 2010. And Callum Wright, the executive officer, it's a community-owned super clinic that is and is right in the heart of, if you know Bendigo, right next to Bendigo Base Hospital, and surrounded by hospitals. It's also a training clinic for Monash Rural School of Rural Health, and for La Trobe University as well. And Callum, and I have his permission to use them as a case study. But Callum told me that using Gen AI, Microsoft Copilot, and ChatGPT have saved him 16 hours a month preparing the monthly management report. It used to take him 3 days every month. And because it has a board with many stakeholders, including Bendigo Health and community directors, etc., he has to have all of this done in time for their board meeting. And it's quite a large report with lots of metrics and dashboards, etc. And this is what he says. It allows, by saving that 2 days a month, it has allowed him to focus more on growing the business, more time for finding GPs, registrars, alliances, specialists, allied health, medical health practitioners. It's that 2 days a month has provided him with the time capacity for those relationship linkages. Imagine in your own practice if you had an extra 2 days per month. Now, Callum is not a clinician. He's the executive manager there, but he's responsible for juggling all of these requirements in a very large, very busy clinic. Now, here are some pros and cons. He treats it like just another resource that reports to him. For example, he has managers, the nursing manager, he has the clinicians that report to him, and he has the admin manager, the business manager, the reception team manager. It writes the reports like any of these management that report to him, any of these managers that report to him, and instead of cutting and pasting and modifying their reports, he gets Copilot to do that. And now, Callum, interestingly, he has been he has a degree from Oxford. He's he communicates very well, but he says that Copilot writes more clearly, more concisely, and quicker than he does, and it doesn't require as much cognitive effort to just modify it and to fine tune it. He says you must reread. These are must-dos. I should highlight that with the yellow highlighter. You must reread all the output. You must check the facts. No patient info, no sensitive financials, no intellectual property, etc. It's great for policy development, to responding to customer complaints. He told me, have a look at this, that it actually writes a letter back to a customer with much more, what's the word, compassion and in a softer tone than he would. It writes newsletters for them, and it's reduced the cost of compliance reporting to all of the organisations they have to report to, the RACGP, to the local PHN, health department, etc. He doesn't like the American spelling. He uses AI for repeatable and auditable elements, not for answers to complex problems. That is where humans have to get involved. Now, privacy and cybersecurity obligations. Healthcare is highly, highly regulated for a reason, because it involves our health. The Australian government in September last year issued a policy for the responsible use of AI in government. And this particular policy, it basically gives us a framework within which government agencies must work, and this framework, the principles, the if you like, the use of AI in a responsible manner and in a safe manner, that will filter down to all of us, whether we are in the public or private sector. And it's a good thing that the government has done this. It talks about the risk. It talks about, now, does anybody remember robo-debt? Robo-debt was a disaster, and it caused some tragic outcomes where the AI in robo-debt made mistakes and hounded people, and it had tragic outcomes. That was a result of AI being used without the care taken to mitigate against the risks. So please be very careful of these. Have a look at these when you have time, when you get the slides. Interestingly, the interim guidance from the year before, while they were working on the other guidance, what the government said to public servants was that they should be able to explain, justify, and take ownership of your advice and decisions. And if you used AI to help you get that decision or to formulate that advice, well, you better be able to justify it, and you're responsible for it. And here's the other thing, which is why I have this slide. Assume that any information you put into a public generative AI tools could become public. Don't input anything or upload anything that could reveal classified, personal, or otherwise sensitive information. So, ChatGPT is a public AI tool. Google Gemini, or used to be called Bard, is a public AI tool. Just as two examples. Please be aware of that. Once it's up there, it's gone. The Queensland courts have some interesting guidelines to people who are appearing with and who come before the courts, and they advise that we need to understand what their capabilities and their limitations are. And they say that Gen AI chatbots are not actually intelligent in the ordinary human sense, and the answers are not the same. They're not analogous to human reasoning process. And then they go through explaining why with large language models, etc. But this makes it very clear. Their responses are based on probability-derived calculations about the next best word in context. And because of this, these tools are unable to reliably answer questions that require a nuanced understanding of language content. They have no intrinsic understanding of what any word they output means. They don't actually read English. It looks like it reads and understands a language, human language, but it doesn't. It's just a token or a symbol. Nor do Gen AI chatbots have a conception of truth. This is very important, which will become clear a little bit further down when we talk about some of the things where AI has gone wrong. Gen AI chatbots are not search engines. They don't provide answers from authoritative databases, but rather generate new text using a complex algorithm based on the prompts they receive and the data with which they have been trained. Okay, please be aware of these. Well, they're features. It's not a failing. It's actually a feature of the way that these technologies work, and we just have to be aware of them. In the National Framework for the Assurance of Artificial Intelligence in Government, here are the 8 principles, ethics principles that the government applies to its agencies, and we would be well advised to follow the same 8 principles in our use of Gen AI tools. And last year, the International Standards Organization issued us a standard for the development and management of AI tools. Now, I just want to talk about cybersecurity, because security, as you'll see, is also a very important factor in generative AI. Health service providers, this is the latest report. They're usually a few months after the 6-month period. We don't have the one for July to December of last year yet, but health service providers have been #1 since the notifiable data breach scheme came into force. And I just remind everyone about the reasonable steps and the active measures that we have to take as APP, Australian Privacy Principle entities that all healthcare providers are. So that applies not only to your network, your data, and managing the privacy and security and the confidentiality of the data on your networks, but it also applies to the use of Gen AI. And of course, here we go. Gen AI has limitations, and there are some cons to Gen AI. It fabricates. Now, quite cutely, those fabrications are called hallucinations, where I might say it just flat out lies, makes things up. It has biases. It has privacy concerns. There's misinformation, disinformation. There are bad actors creating deep fakes with AI, AI-driven cyber attacks. Please proceed with caution. Be aware of the negatives while we're gaining the positives. Now, when you go to ChatGPT, when you first log in, you have to have a login. It pops up with this: don't share sensitive info, and explains that. You can click on that Help Center link. Check your facts. ChatGPT may give you inaccurate information. It's not intended to give advice. Now, that might be a disclaimer so that they can say, well, we warned you, don't rely on it, in case anyone thinks of suing them. Now, just in the last couple of weeks, you would have heard of this new chatbot, AI chatbot called DeepSeek. I'm sure if you've watched the media or listened to the news, and this was developed in China by a Chinese company, and it has been banned in Australia because the Australian government, all Australian governments have banned it, and they have concerns. Home Affairs Minister Burke said DeepSeek posed an unacceptable risk to government technology and data, and it was to protect Australia's national security and national interest. The ban doesn't extend to private citizens, but my suggestion is if you have anything that's sensitive or intellectual property or confidential, you shouldn't be putting it on any of these chatbots, including DeepSeek or any public chatbot in any case. But there you go. That's caused a real ruckus, and various countries, I think Spain's banned it, South Korea's banned it in the last couple of days. And the reason why is because they claim that it is too closely associated with the Chinese government, and that part of China's legal requirement for these technology companies is that they must cooperate with their security agencies, and that is something that various governments are not happy about. Bad actors are also using generative AI tools. There is a fraud GPT. There is a worm GPT. And what they do is they create cyber attacks. So the Australian Federal Police is warning us to be very careful. And AI is really worrying the law enforcement agencies because it enables the bad guys to turbocharge their nasty attacks. We have to be careful of that. I'm concerned as a cybersecurity practitioner. I'm very concerned about the cybersecurity threat that AI-powered attacks pose to us. That's something that that's in my world. The one thing that keeps me up at night is getting a phone call or getting a message that one of my clients has had a cyber attack or a ransomware attack, and the AI is doing the same kinds of attacks, just faster, smarter, and harder to detect. And here's a forecast from a US media company saying that beware, it's going to supercharge attacks, especially as quantum computing gets closer. So all of these known attacks before Gen AI, social engineering, ransomware, triple extortion, credential theft, etc. All of these are being powered by Gen AI now, but we also have generative AI specific attacks and risks, and you can have a look through these. There's lots more. There's model attacks, etc. Now, AI hallucinations. Remember that when I said no, that's a euphemism. It's just flat out lying. This is a guy who will never forget that lesson. Stephen Schwartz, a lawyer, he used ChatGPT in his research for a personal injury case that he was in charge of. And it turned out that ChatGPT totally made up these legal cases, and he came within the skin of his teeth of being struck off practicing as a lawyer, and he got fined $5,000. His fellow lawyer got fined the same, and the firm was fined $5,000. And that's because he thought that what it was doing, that it's just a search engine, that it was true. It's not. Remember this, ChatGPT and all other Gen AI can hallucinate. Closer to home, 4 Australian professors of accounting were in a Senate estimates committee submitting a report to the Senate and to the committee, and Professor James Guthrie used Google Bard, which is now called Gemini, for this submission into the conduct of the big 4 consulting firms and banks. And basically, the Google Bard said that they'd committed, that they were involved in illegal activity, etc., etc. And that relates to Deloitte's, KPMG, Ernst & Young, and PricewaterhouseCoopers, PwC. And totally, have a look at this. All of these claims are false. Not true, just made it up. And Professor Guthrie did not check the sources, and the other professors and Professor Guthrie were very embarrassed. Luckily for them, when anything is said in Parliament or to a parliamentary committee, it's underprivileged, so you can't be sued for it. Otherwise, the NAB and Westpac and the other firms may be suing these people. Here's one in Victoria. Channel 9 Nine News did a story on one of our Victorian MPs, Georgie Purcell from the Animal Justice Party, and they used this image, the one with the crop top. If you can see the one on the left, not the one on the right, which is the dress is all the way down, and Miss Purcell was outraged that that's obviously not a true representation of her. Have a look at what she says here about the image and the outfit, and she says, can't imagine this happening to a male MP. There was a huge backlash against Nine. They said that it's because they used Adobe Photoshop's generative expand tool. So Adobe Photoshop has a generative expand tool, which is AI. And it can just take something. So you could say, here's a photo of Miroslav down Collins Street. Put Miroslav in this photo and put him in Tokyo, right? Bang. Photoshop will do that. The ABC didn't believe Channel 9, and so they went to Dr. Thompson at RMIT and said, is this true? If you give Photoshop less data, does it imagine and create stuff or new image? And he said, yes, it does. And so the ABC gave just a headshot of a male to Dr. Thompson, and he ran it through there, and look at the differences. Look, one guy's holding a beer. This other guy's got a different color shirt and a t-shirt and looks different. And this guy here's got a lanyard with a different shirt again, all generated. So it's almost to the point where unless we check and double check, we can almost not believe our eyes, not believe what you see. Here's another one. Air Canada used a AI chatbot on their website. It made a mistake. It refused to honor what the chatbot said about a bereavement discount to this young fellow when his grandmother died. He wasn't happy. He took them to court and they lost. They argued that the chatbot is a separate legal entity that is responsible for its own actions. Wow. But the tribunal found, no, you are responsible. It's on your website and you are responsible for all the information. It doesn't make any difference whether the information comes from a chatbot or a static page. And adding that the airline did not take reasonable care to ensure its chatbot was accurate. In other words, we cannot blame the AI when things go wrong. Okay, so generative AI in primary care. We have to have guardrails. Just as we have to have guardrails in dangerous environments to protect humans, to protect our safety, we have to have guardrails with generative AI. You have to set your foundations. You have to review and refine your data management policies to support safe and effective use of AI. For example, the AI has to be told, no, you can't go unless it's been properly configured. You can't go to the HR data. You can't go to the clinical information, etc. You have to identify sensitive information and implement security measures to avoid unexpected access. You have to classify the data. You have to not only classify the data, you have to put sensitivity labels on the data before you let the generative AI technology into your network. And then you have to streamline your data so that you get better results. Please take these as very important steps. Cordelia James writes for the Wall Street Journal, and she says, only use AI to do work. You can easily verify and be sure to check its work. Very good advice. Okay, so now we have, how are we going for time, Natalie, by the way?
I was going to say we're running a little bit over, but we're getting into the nice juicy bit, and there is no pressing questions.
What I call the fun part.
Yeah, the good bit.
Okay, so we know all the dangerous bits. Now we're going to have some fun. So assuming we've done all of those things, we've put mitigations in place, etc. Now, once we've implemented appropriate data safety, security guardrails, practice managers, clinicians can use these tools to generate, transform data, emails, documents, spreadsheets, presentations, meetings, etc. For example, here are some tools that you can use. I'm going to be using Microsoft Copilot only because I have licenses that I've paid for that. I use Microsoft 365. I'm sure many of us use Microsoft Word, Excel, Outlook, etc. But there are alternatives. Some people use the Google Workspace, for example. Have a look at these links. These are tools that you can subscribe. You can buy licenses for. You can use. I go to this website called Poe. It's an aggregator, poe.com, and you can get access to just about thousands, literally, of AI chatbots and tools, and all of them. And there's another tool there, Google Gemini, etc. N8N, workflow automation. Have a look, evaluate what suits you best, including a cost and how quickly it goes. It aligns with your needs. Okay, just a little bit on Microsoft Copilot family. Now, I'm not endorsing, recommending, or promoting. I'm just using it as an example because that's the one that I've bought licenses for. That's the one that I've been experimenting with and using, and we use it in-house, for example, in our Teams chats, etc., to use it for transcription for meetings. There are different co-pilots. It's not just one product. And there are different levels of it. In Copilot for Microsoft 365 is what we used to call Microsoft Office, Microsoft 365 apps. Inside of chat, it's in, if you go to Windows 11, if you're using Windows 11, it's in that. It's if you go to, if you just go Copilot in a browser, it'll come up with Microsoft Copilot. If you use Bing as a search engine, it's available. That's free. There are various different products, etc. You can have a look at that if you're interested in looking at the Microsoft offerings. One thing I do like about Microsoft Copilot a lot is that I can restrict where it goes. I can lock it down. I can tell it you're not allowed to go to the internet. And anything, all the questions I ask, the prompts and the information that I get out of it is locked into my tenancy, my Microsoft tenancy, and it does not, Microsoft does not have access to it. They can't look at it. They don't send it anywhere. They don't use it to train on. That for me is a plus, because I'm a bit of a paranoid person when it comes to security and privacy, and I think that's one good thing about the Microsoft product. Once again, you can control your data. You know where your data is, and they spend a lot of effort on that. I think all the others are going to do the same thing if they don't do it already, because everyone's concerned about privacy and security and confidentiality. However, Microsoft look after the data and the product itself, the production environment, but we as the users are responsible for that. For our part, who do we give access to? Have we set it up properly? Are the users accountable for using it? Please be aware of your own responsibility in using these tools. And then there are, it needs to be configured. Like anything in security, it needs to be configured. There are some people that need to be excluded. Some people need to be given access. It needs to be on the role. So role-based access controls is an important term that your IT or your security person you should be saying, I want role-based access control. And then they have different levels of it. Have a look through that. And once again, different levels, sensitivity labels, conditional access, etc. Now, how do we build an effective prompt? Here's some examples. I want a list of 3 to 5 bullet points to ... for an upcoming meeting with Natalie, focusing on Natalie's current issues or questions and what she's looking to achieve. Be as specific as that. Now respond with a friendly tone but authoritative, because I'm going to tell Natalie about cybersecurity, for example, and focus on the emails and Teams chat over the last 2 weeks. And so if we do that, we will get good outcome. Here are some do's and don'ts. Have a look at these. This is really useful. And this applies not just to Microsoft Copilot. Please, these principles, these apply to all of the Gen AI tools that you use. Really interesting. Be polite. That's one that's, I think, a bit hilarious. But anyway, review your prompting best practices. Just reviewing on that. Have a look through that. Understand limitations. Be curious. Ask it again and again. If you're not happy, just say, "Oh, make that. Give me references. Make that more concise. You didn't answer this properly. Please focus on this more." All that kind of thing, which we will look at. That is AI and the do's and don'ts of AI. So now what we're going to do is we're going to have some fun, and we're going to look at the Copilot for Microsoft 365, and we're going to spend some time looking at the Microsoft features. And before we go into the actual demo, I just want to do a recap on building an effective prompt. And what we discussed is you have to tell Copilot or the AI chatbot what you want it to do. Give it clear instructions. For example, I want a list of 3 to 5 bullet points for whatever you want to create. Give it the context, and that'll become clear when I bring again the examples that I'm going to use from Callum Wright from Bendigo Primary Care of how he uses Copilot for improving his productivity. What's the context? In this case, for an upcoming meeting with a client, focusing on what you want to focus on. Now, this is interesting. Respond with a tone that is friendly but authoritative. Be polite. Be courteous to the AI, which is, as I mentioned, which is a bit bizarre considering we're talking to essentially a machine. And what source information do you want it to look at? Do you want it to go to the internet, to a particular website, or do you want to use a document that's in your network? Tell it where you want it to get the information from. This is a very useful summary slide of the do's and don'ts. Have a look at this when you print this out. This is interesting. Don't use slang, jargon, or informal language. So really it's a professional style language would be most appropriate, as you would if you're talking to a young intern or a colleague in the clinic. And once again, provide clear and concise prompts. Experiment, and if you're not happy with it, tell it that you're not happy. Say, no, that is incorrect. Then what you can do is give it the context, and then then what you can do is you can see how it responds with your requests for different styles. I want a more professional style. I want it more a more relaxed style, or you give it the context. Don't be vague or general. Don't put so many questions into the one prompt. You're better off having a series of prompts, and don't assume that this Copilot in this case has the context. You have to tell it what the context is. Yeah, iterate. Don't give up after one prompt. It's a dynamic process, and interestingly, because it is a predictive tool, have multiple goes at it, and it will get smarter, and it will learn as it goes along. It will learn the sorts of things that you want to ask it, and it will learn from the documents that you are giving it access to, from the information that you tell it to base it on, and it will put that back into its training. So it is an iterative process. So just remember those, have a look at those slides. Now, just to remind us all, what is an AI system? Well, it's a machine-based system that infers from the input it receives how to generate outputs, such as predictions, content, recommendations, or decisions that can influence physical or virtual environments. And so please don't forget this. It's not a lookup tool. It's not like doing a Google search. It's a predictive statistical tool which does get better and does learn. Okay, so we'll have some fun now. We're going to look at Microsoft Copilot. And as I mentioned, I like Microsoft Copilot because it is more secure. You can lock it down to totally your tenancy, your Microsoft 365 tenancy, and your network. You can tell it, you can put guardrails around the sensitive data that you have. And what you can also do is you can give it very clear guardrails as to where it is allowed to go on the internet and where it's not allowed to go. So you can put trusted sites on there, and that'll become obvious. We're going to tell it to go to the RACGP website. So let's have a go. I'm going to minimize now this, and I'm going to bring across Microsoft Word. Now we're going to concentrate on Microsoft Word and Microsoft PowerPoint so that I can explain how the functions work inside of these two products. I'm just going to make it larger, and we'll make it page width. Hopefully everyone can see that. Now, what we have here is very specific Copilot. I'll go to the home screen there. So I can just click on this, write an article based on a file, a particular file, create a plan for whatever it is, a meeting or schedule or planning that you're doing, or create a proposal. Now, what's interesting is every few weeks, these things change and they add more of these functions here. In this button here, describe what you would like to write. So if I click in here, I can give it instructions in here. Or if I click in here, what I can do is I can actually start writing in here. So this is what's called the in-document pane. So I'm inside the document, and just to show you the document, I'll just go back to full page view, 100%. There we are in the document, okay? But what we want to do is I'll just go back to page width because it's easier to look at. I'll go back to the home screen, and you can see the Copilot specific commands and functions. Now in here we have these three little dots. That's more options are available. I can give it feedback or I can close Copilot. If I hover over this, I'm not sure if you can see that, but it means reference your content. And here I can, once I give it an instruction here, if I click on this button here, that's like the enter key or generate the, or carry out the instruction that or the prompt that I've written in here.
Sorry, can we maximize that screen by clicking up in the right-hand corner?
Okay.
Better, yes, thank you.
How's that? Is that better?
I think that's better, yes, yeah. Thank you.
Thanks, Yvonne. So in here, I can write in this box here. However, this is limited in the in-document Copilot functionality. In the top right-hand side, if you can see this, there's another Copilot button. Now, this is the Copilot symbol, this sort of multicolored, I don't know, ribbon, sort of circular ribbon logo thing. That is the Copilot logo. And you'll see that in all the Microsoft products. That's the Copilot logo. If I click on the button up here, which we'll do, is what happens is that I get a screen, a panel or a pane, a Copilot pane on the right-hand side of my screen. Now, I can actually make that larger. Okay, so you can see that. What I've just done here is I've gone to the scroll bar there, and I've just hovered my mouse over it, and I can adjust the size so that I can actually see what we're going to do. Okay, so, and then it gives you a few more options in here, and it's got some more commands down there. Add an image, view prompts, manage the content preferences down there. I can turn on the microphone or disable it. So I can actually dictate instructions to Copilot. Now, what I'm going to do is I'm going to go to another document that I have. And if you remember, we spoke about Callum Wright, who's the General Manager at Bendigo Primary Care Clinic. And he gave me one example where they had a requirement to create some policy documentation. And what he needed is a home and other visits policy. Now, just for reference, I'm going to go to the RACGP document here. This is the RACGP 5th standard. I'm sure most GP practice managers and doctors are familiar with this. Nighttime reading, isn't it? So if you can see here, I have all the core criterion, the core standards, and then down the bottom here is I have different quality improvement modules, and GP Standard 1, access to care, and GP 1.2, home and other visits policy. So if I click on that, this is the quality improvement. We need to have a policy. Now, Callum didn't have one, and they needed to have one for accreditation, and so he used Microsoft Copilot. And what Callum started with, and I will maximize this page now. Can you see that okay?
Yes, great, thank you.
Okay, great. And I'll go to the home screen. And so what did he want? And this is a verbatim quote that from Callum's prompt that he used to write a home and other visits policy. Okay, write a home and other visits policy for Bendigo Primary Care Centre. Okay, that's the instruction, clear instruction. Here's the context, which is a medical practice in Victoria, Australia, that meets the legal and regulatory requirements and the requirements of the RACGP 5th edition standards. Okay, so I'm going to copy that, and I'm just going to do a Control-C. Then I'm going to minimize that, and I'm going to go into our blank. This is our blank document. Has nothing in it. We've done nothing in there, and we've done nothing in here. So
can we maximize that a little bit, and maybe the bottom right hand corner where you've got the 100%, like if we could make it a bit bigger, that way we could see a little bit more when you get in there.
Let me make that side a bit smaller, and then what if everyone can see that?
Yeah, perfect. It's where the magic happens. We want to make sure we see it.
Yeah, absolutely. And these days with small screens, it's all a bit hard. So now I have copied Callum's prompt, and I'm going to paste it. Okay, so if you remember, this was the prompt. Write a home and other visits policy for Bendigo Primary Care Centre, which is a medical practice in Victoria, Australia, etc. Now, I'm going to reverse that, and I'm going to go to, I'm going to close that. And I have to go make that a bit smaller, actually.
Sorry.
Otherwise, I don't see the other parts of the menu. Okay, now see that little icon, draft with Copilot? Okay, then I'm going to paste that in there. Okay, and I'm going to hit, okay, and I'm going to transform with Copilot. So we're going to do that. Okay. And actually, that's, I've got to get back to the menu that I had before. Let me just go to file.
We can cut some of this out, so don't stress.
There we go. So this is the in-document version, and I've put it in there, and notice the three little dots, more options. This is the generate.
Wow.
Okay. So now I started with a blank piece of paper. Now, what I'm going to do is I'm just going to make this into one-page view, right? And I'm going to make that a bit smaller so that I can put the actual RACGP document beside it. And now, how long did that take, Yvonne? That would have been, what, 10 seconds, maybe?
Yeah, if that.
If that. Now, have a look at this. So, home defining safe. Home and other visits. GP 1.2. Why it's important, meeting this criteria, who can perform the visits, making home and other visits. So there's all the information, right? After hours, meeting each indicator, etc. And let's have a, that's what we're supposed to come up with, all of those instructions. And what have we got? We've got an introduction, which talks about the context, the purpose of the policy, the scope, the legal and regulatory compliance requirements. Look at this, the Health Practitioner Regulation National Law Act 2009, Victoria, because each state has its own little addition to the national law, and because we told it to meet the requirements, which is a medical practice in Victoria, Australia. See that? It's actually put that in. So it's actually gone to the Victorian version of the National Law Act, the Privacy Act and the Health Records Act, and etc. The criteria for the home and other visits, right? So the patient is unable, procedures, conducting home visits, safety protocols, other visits, review and evaluation, conclusion. Now, how long would that take a practice manager to, from a blank piece of paper, starting to do that? Now, I'm not a practice manager, but practice managers tell me that that's at least an hour to 2 hours of thinking about it, copying and pasting and rewording it, etc. And we've done that in less than 10 seconds.
Amazing.
And look at the language. It's very similar. It's very professional, what I would call formal language, right?
And the main point was to make sure that first sentence and what you're asking for was concise.
And it's concise and it's all there. Now, what you more than likely will do is you use this to start with. This is now the framework. And from that, you can put in, now notice what it's done here. I'll make this full size, Yvonne. So notice this policy outlines the process and conditions under which home and other visits are conducted by Bendigo Primary Care Centre. It's actually customised it. Now, I think this is fantastic. But remember what we said, the human has to check just in case it goes a little bit mad or puts things in there that are not correct. Remember what we discussed earlier in the presentation, a generative AI tool does not understand the difference between right and wrong, between true and false. It's a statistically predictive tool, but boy, this is pretty good. Look at this. The purpose is to ensure the provision of high quality medical care during home and other visits, ensure compliance, etc. So that has been, there it is. It's fantastic. Now, notice that there are no references in this document because in the document pane, it's not as clever. But if we now, if I now go to, I'll just make this smaller. And we'll go to the home screen. And then we're going to go to the Copilot. So I'm going to, now what it's done is it's created the bones of the policy or pretty much what I want, and I'm just going to go and change that. But what I'm going to now do is I'm going to undo that, and I'm going to go to the Copilot, the main Copilot pane on the right-hand side, and I'm going to make that a bit bigger, and I'm going to modify this, and I'm just going to paste in exactly the same, but I'm going to say to it, please add reference and links. Okay, I'm going to, I want references and the links to those references because I might be creating that document with all of the reference sources for my accreditation documentation. And I can add an image, I can do all sorts of other things in there, and I can view the prompts, the history of my prompts. So we're going to go through, I'm going to go send, generate that. Okay, and I'll make that bigger, and you can see it basically creates the same. Now have a look at this. It's added the references for me. RACGP standards, the external link was removed to protect your privacy. That's because in my network, on my computers, we have very strict cybersecurity and access control guidelines. But what I could do is I can put the links in here if that's connected, and see, there you go. I can click on that, and what I've done is I've clicked on that link, and on my other screen, have a look at this. See, it's actually found the codes, guidelines, and policies.
We can't see the other. We can't see
website.
We can't see what you've pulled across the screen, though. There it is. Yes, now we can.
Now you can?
Yes, we can.
Okay, and that was just by click. I didn't have to go looking for it. I didn't have to go to Google and do a search. Okay.
Amazing.
So I'll move this back on my other screen, and see here. So I've got the look. See that? There's the link to the RACGP website with the standard. Okay, and so I could add those links in there into my references. But there you go, and I can modify that, and I can say, can you please expand this policy expand this policy. That's it. And I'm going to hit enter. And I'm going to add an image, and I can upload from the device. If you had an image, you might have your logo of your clinic. So if this was Callum at Bendigo Primary Care, he might have the image of Bendigo Primary Care logo in here. I can view the prompts. Okay, so this is these are suggestions that Copilot has, and it has all sorts of suggestions. Look at this. So you can start from, how can I more concisely describe, explain this in 3 sentences, summarize it, find specific information, pros and cons, who's who, improve this document, give me examples, summarize it, create a banner. You can ask it to add a table of contents, stock image, discover. It's just, look at this, all these sorts of things that are generic, but one button, one click. You know, if you're working on HR, create a guide on how to advertise job openings to qualified candidates. All sorts of stuff in here. It's just very, very handy. And the other thing to keep in mind is look at the prompt. Look how concise they are. Help me create a framework to conduct a time to value analysis for new initiatives. Create a template for line inspection reports. You know, plain English. You know, really easy. And then you can see more prompts, more suggestions. So please expand on this policy with more detail. Okay, and I'm going to hit enter. I can manage the content preferences. There we go. See, more detail. So it's given me more depth compared to that there. You can see there's the home and visits policy there. Is that clear? I'm not sure if I can make this text bigger. Can you add a section on patient consent? Oh, of course, I forgot that, right? And see how it's actually learned. Now, Yvonne, this is really interesting. It is learning from what I'm doing.
Yeah, that's amazing.
What I've asked it to do. Include guidelines for handling emergencies during home visits. Okay. Can you add a section on patient consent? Right. And then so that's the previous one. So it's looking through all sorts of sources.
So it might find another source and realise that there's patient consent on this other document, and therefore it suggests that's what you would need here.
So it will go through the entire RACGP guidelines or standard.
Okay. It's just endless.
There you go.
It is a little bit hard to see, but on a bigger screen, if people view it on a bigger screen, I'm sure they'll be able to get a good view of it.
So if you zoom up onto it, I'll see if I can. So that's the zoom only works in the document pane.
That's right, not in the other pane.
Not in the Copilot pane.
That's right. If you have a look on the bigger on a bigger screen, the laptop is a little bit difficult, but on the bigger screen you're able to see it.
That's right. But there you go. I've got patient consent, and look what it's done. It's actually said, can you add a section on patient confidentiality? So it is learning. It is starting to say, hey, what about this? Because it's looking at what are the legal requirements for substitute consent, right? What about emergencies? Because it asked me previously about can you one of the prompts was what about can you add a procedure for emergencies? During home and other visits. And see, this is what it means by it's an iterative process. It's not a one shot at it. You can refine it ad infinitum. And here you go. It's doing all of this. So it's repeating obviously the things that I'm happy with.
It's definitely like having an intern, isn't it?
Yeah, and that's what people have told me. It's like having an intern that's quite knowledgeable but doesn't have any experience. So let's say they're straight out of uni. They're very keen. They're good students. They want to help, but they don't know how to work in a GP practice. This is their first GP practice. That's the context. But it is amazing. Look at this. I've added patient consent. I've added now procedure for emergencies during home and other visits, patient feedback, confidentiality, and we could go on. And now all I'm doing is clicking one button or very concise prompts that I'm typing in. I'm not having to start from scratch, or it's going away and doing it.
Right.
And of course, what I would do is I would, at the end of this, we're going to say, okay, that's enough. Then I'm going to incorporate that into my Word document. And then I'm going to create from this policy, then we're going to go into PowerPoint and we're going to have a look at what can we do with that. So here we go, fees and billing. It's a little bit slower because it's going through more documentation. If you remember, it was really quick at first when I was over on this other side. emergencies.
So you recommend to go into this pane to get a more concise
No, it's just
document, do you
this
think?
gives you more options.
Okay.
The full Copilot pane gives you more options. That's the only reason. So there you go. I've added confidentiality. You can put staff training, etc. But that's enough.
Great.
And so
Great.
see this button here, insert. I'm not sure if you can see that
Yeah,
very
it's
well.
quite small, but yes, we can see it's a second button.
There's an insert button. I can copy all of that without having to highlight and select it. I can just click copy. I can like it, which is good because I can give feedback to Copilot. I can say, yep, I like that. And I can tell it why or give it context. I'll cancel that. Or I can not like it. I can say, no, you've made a mistake. And I can ask it to read it aloud. And
wow.
So it's got all of that. Let me insert that into my document. There you go. How about that? There's my home and other visits policy with emergency procedures, patient consent. We added those, confidentiality, and we've got the references. See that? So yep. That's fantastic. And if I wanted that as a link, I could just do this and I can get rid of this and hit the space bar and there you go, there's my link.
Wow.
And now, starting from a blank piece of paper with one little paragraph, so I can go all the way up on the other side here. If you remember, I can go all the way up to my prompt, right? Write a home and other visits policy for Bendigo Primary Care Centre, which is a medical practice in Victoria, Australia, that meets the legal and regulatory requirements and the requirements of the RACGP 5th edition standards. And then I have added, please add references and links, okay, which I couldn't do in here. So there you go.
Perfect.
Microsoft Copilot generative AI. It has generated new information that I didn't tell it to. I didn't control this. It went away to various. It went to the medical board. It went to the RACGP. So it's just, from my point of view, it's fantastic. Now, here's the interesting thing. I'm going to go to PowerPoint and I'm going to go to a new, and I've got in the background our slides, okay? And what I want to do is I want to minimize this one and I just want to create a blank PowerPoint. Okay, blank presentation. And now notice this. Okay, so we are now in Microsoft PowerPoint. Notice that I have a Copilot button here, which is the equivalent of the in document button in Word. But I also have a Copilot button over there, which is the main one, which then gives me that pane, spelled P-A-N-E, on the right-hand side. And I've got the two functions, okay? So what I want to do is I want to create a presentation from a file. And the presentation I want to create is from the home and visits policy. So I'm going to go from here and I'm going to go to, and I can, now these are all in my, in my Microsoft OneDrive, in my tenancy. And I've already created that policy previously that I had in there. So what I might actually do is I'll go back to my Word document. Okay, so this is my example. I'm going to save that, and I'm going to put it into my Copilot demo. I think is it in this one? Yep. And the policy, and I'll call it number 2 just in case. And I'm going to save that. And then I'm going to, so that's it there. I've saved it. I'll minimize that, and I will go back to here from file, and from all. No, I may have saved it in the wrong place. I'll save it again. So just bear with me 1 second.
That rookie mistake.
Yeah.
Miroslav.
That's it. So I'll save a copy, and I'll save it into this one. Hang on, browse.
Don't forget, we'll all be able to see what you're browsing.
And oops. Right, I think it's in there. Yeah, I'll save it in there. Okay, and then I'll go back into here. It has to, your SharePoint and your OneDrive has to be set up, otherwise it doesn't know where to find them.
Mm-hmm.
So I'll go back into here.
Can you search for it?
I can actually tell it to from file. So I can copy this. That's in Copilot. Apologies for this.
It's good to know even the experts lose some files every once in a while.
It wants it into the SharePoint. Look, I'll use one of the other ones that I've already created. So there we go, and create a presentation, and it's finding my file in. This is one that I did previously, and it's generating the slides. And for anyone who has to create a presentation for a meeting, a doctor's meeting, or a training visit, etc., have a look at that.
Wow.
I mean, how long did that take? 5 seconds?
Yeah.
And so if I go to view, and if I go to slideshow from the beginning, what do you think about that?
It's amazing. Really?
Look, and it's even found American, our doctors don't wear white coats, but, sort of the theme, it's themed it, hasn't it? There you go.
That is truly amazing.
So
how quick was that?
And have a look at this. BPCC, adheres to RACGP 5th edition standards, etc.
And of course, you could go in and change those images if you wanted to, couldn't you?
Yeah. This is, look, you can do whatever you like with this because, see, look what I'm doing.
Yes, of course.
This is fully
customizable.
This is just providing you with the starting point.
Amazing.
And then the other way, you can turn this around and I can say from this presentation, so I could go back to our presentation here, if you remember, and this has got lots of slides. I can go into this presentation, I go into the home screen, and I can tell Copilot to create a Word document from this, or so summarize this presentation. And
you'll get a summary.
Yeah.
Wow.
So, and now this presentation has 98 slides. Now have a look at this. There you go. It summarized it. And there you go. There's our acknowledgement of country, Northwestern Melbourne Primary Health Network, housekeeping, speaker introduction, implementing generative AI in healthcare. Like it took seconds.
So you're saying we can summarize it all into, like, what is that, 5 dot points?
Or I can say, give me more detail.
Yeah.
Summarize again. Oops, if I could spell. With more detail from each section.
That's amazing.
So this is just an example. Now you could be using other tools, Google, Gemini, ChatGPT. Though Google, Gemini and ChatGPT are public generative AI tools. Anything you upload into the public generative AI tools, you no longer have control. And do not put, if you remember, do not put sensitive information, private information, confidential, business confidential information. Don't upload that because you've just let the whole world know about it.
But you're saying you're able to upload the business sensitive information onto Copilot.
But Copilot must be, all of these tools must be set up. What you need to do is you need to go through an exercise. If you remember this slide back here, this one here, you have to review your data and you have to classify your data. You have to put sensitivity labels on the sensitive information. You have to apply your guardrails. What that means is you have to tell the generative AI tool where it can and where it cannot go.
Amazing.
Okay.
Amazing.
And then what you can do is you can then streamline your data so that it's faster and more, faster and more efficient. But have a look at this. I asked it to review this 98-page document with more detail. Now see this, right? So it's given me more information from each section because I asked it to summarize again with more detail from each section.
Correct.
See the iterative process?
Yes.
You're not finished until you're happy with it. When you're happy with it, and then say, go, thanks very much, give it a thumbs up.
Done.
Incorporate that into whatever you're doing. It's fantastic. Now, Microsoft, if we're going to be looking at Microsoft 365, it also has Copilots in Outlook, Copilots in TeamViewer, Copilots in Excel, which is fantastic, but you could spend an entire hour demonstrating just the power of the Copilot in Excel for doing all sorts of stuff.
Maybe that's another presentation, Miroslav.
I think so, but I hope that this gives you the listener, the practice manager, the doctor in clinics, the whole point of this generative AI is to give us some, give us an assistant, a personal assistant that can help us get back some time, quality of time. So to do all that, you know, we've all been using Word and Excel and PowerPoint and Outlook and all these things, and it's, you know, and you've got information in different silos and they don't talk together. Whereas Copilot does, it starts to join, can get the information out of one bucket and put it into another bucket, another program, another application, and it can do all this behind the scenes stuff for us. It's like you've got a young, I don't know, you've got a young student who's doing all the odd jobs in the clinic. I want you to scan all these letters from these specialists or from the hospital and put them into the patient records. And I want you to do all these things and go around and see Yvonne and ask her if she wants you to do anything. You know, think of the AI like that. Yeah. Right? It's not magic. Right. It's amazing, but as you use it more and more, it will learn your style. It will learn the sorts of things that you're looking for, and it will build up. It will become smarter for you. I hope this has given you.
Thank you.
Well, a taste for one, how amazing it is that we can go from 98 to, well, if Yvonne said to me, oh, that 98 slides is ridiculous, Miroslav, can you summarize it? Well, here you go, Yvonne. I can just do that.
Amazing. Thank you so much, Miroslav.
And then, of course, in my Word document, what did we do? We started with this, a blank piece of paper where we wanted a home and other visits policy. We wanted it to refer to legislation and regulations, including the RACGP 5th standard, which is here. And what did we get out of it? Well, we got out of it a home and other visits policy that we had a number of goes at it, and we gave it more and more detailed information, add a section on patient consent, confidentiality, emergency procedures, and we've iterated and iterated. And what did we get at the end of it? We finally got the links and references so that when the time for accreditation comes around, or if we want to check our references, look at this. That's the document that we've got.
That's amazing.
So if you approach it with care, understanding what generative AI tools, what they are and what they are not, if we put guardrails around it, I think this is going to make our lives easier. And over to you. Use it and gain some real productivity out of it.
Thank you, Miroslav. That was an amazing presentation. Like, it's so exciting. Like, you know, just to think how easy that was.
Yeah.
As long as those instructions are concise and you're saying please and thank you, that's what I got from that message.
Yes.
It will make us think a little bit about how easy it is to adapt it in our everyday work. But obviously, like you said, just double check that whatever's been produced is correct and it's what we want.
Absolutely, we have to check it. Yvonne, you're correct. And what we have to do is just make sure that, as you would an intern, a supervising doctor would check an intern's work, a practice manager would check a new admin person's work as well.
Right. Okay.
Yeah, so I hope that's been very useful, and we'll see you next time.
Thank you. Thanks, Miroslav.
Okay.
Thanks, everybody.
All right. All the best. Bye.
Okay.
Through, and Miroslav will bring the slides up, was just in terms of, obviously, a lot of resources around emerging technologies, and AI is no different. A lot of the technology actually advances before the legislation and the guidance catches up. So there is some really great documents which Miroslav shared this evening. In terms of ones that are applicable to primary care, they're coming. So the Australian Council for Quality and Healthcare Standards are at the very end stage of drafting their policy on the use of AI in non-hospital settings. And I think conference I was at yesterday, they're expecting that to be out later this year. So once that becomes available, we will distribute that so you can all get a hold of it. In the meantime, other places to go to have your information. So IT providers, that this is why you contract people to help you with this stuff. And like Miroslav's shown you, they know things that I wouldn't even know to ask. So utilize that information. It's really useful. Accreditation agencies, they're very aware of the technologies changing. And obviously, because of that consideration around privacy, the Australian privacy principles and health management of health information, they do have opinions about these things. So that's a really good place to go and ask for those resources, ask for those policy and procedure templates that align with the standards. Your indemnity assurer, so both Avant and MDA, have some really fantastic resources and fact sheets on the use of AI in healthcare, particularly around the considerations with the use of health information and patient information and these tools. All of the peak bodies have position statements. So there's position statements about how they will use AI and what their considerations will be in terms of, I'm forgetting the word, advocating on the behalf of their professions. APRA also has some really great stuff on how to meet your professional obligations as a health professional when using AI in healthcare. I always like to take the opportunity with my lovely captive audience about health pathways. So the clinicians in the room, you're probably very well acquainted with health pathways. So the idea is they are a point of use, point of care guide to navigating through the healthcare system. So in terms of a lot of clinical based decision making, referral information, they're written by, we've got a GP editor team who review and write these health pathways. Outside of clinical, we have subject matter experts who contribute. So one thing I did want to go through, and if we go through to the next slide, there is a heap of information. So the clinician ones, I haven't spent too much time because hopefully you're all aware of it, but there is a whole bunch of administrative stuff, which is really great for the practice managers and admin people in the room today. There is a section for you. So if we go to the next slide, hopefully. There we go. So this is the health pathway screen. On the left-hand side, you have the navigation pane where you can find the information that you're looking for. You can also use the search bar at the top, which I always like a search bar because I'm a millennial and lazy. So under our health system section, there is a list of all the practice management resources. So a lot of this is administrative based, but also a lot of accreditation based resources. So that one sort of stop shop of where do I go to find that accurate information, we've got that published here for you. So in terms of accessing health pathways, next slide for me, Miroslav, thank you. It has now moved from generic logins to a single user login. So you will need to create your own login. So if you haven't done so already, when you go to the Health Pathways website, it will ask you to sign in or register and create your own login. Obviously, just to make sure you're from our catchment or Eastern Melbourne's catchment who have access to our health pathways, and that it's you're not a consumer, because it's not a consumer resource. Wonderful. So that brings us to the end of today's presentation. So I haven't got any questions in the Q&A, and I think the chats we're okay. We'll just pop up to the next slide. So we love feedback, good, bad, middling, you know, what you'd like from us, what you want to see in the future, how you found this session. So if you scan that QR code there, that will bring up a short minute and a half survey, depending on how quickly you type. So we'd love for you to fill that out and get some honest opinions. Hopefully you found this evening useful and informative, and it's got you excited to go and responsibly use AI solutions in your practice. Miroslav, thank you very much for presenting this evening and sharing your wealth of knowledge for us.